Placebo and low back pain. In a previous presentation, we discussed the emerging evidence regarding the placebo effect and the possible genetic relationship to response. In that presentation, we were reminded of the potential power of placebo not just based on belief in the benefit of taking a pill, but the entire health provider encounter, the environment, including the office, procedures, and the demeanor of the healthcare providers. At that time, we discussed a study that actually tested the ability of a placebo to have an effect even when the patient knows it's placebo. The current study we will review tests that effect once again, but this time with chronic low back pain. The title: Open-Label Placebo Treatment in Chronic Low Back Pain, a randomized controlled trial published in Pain in 2016. Prior to the most recent study on low back pain, there were 4 trials showing benefit. One was an RCT of irritable bowel syndrome patients, which demonstrated clinically meaningful benefits over no treatment. This approach, called open-label placebo, actually has placebo written on the bottle and/or pill. So why does placebo using open-label drugs work? Well, certainly partially based on a belief of hope that it will help when nothing else has, or an associated expectancy of benefit because of being part of the health visit encounter. Even suggested are bodily sensations such as twisting bottle tops and swallowing pills. And spontaneous fluctuations in pain may be interpreted by the patient as proof of effect. Let's discuss the current study parameters. Researchers compared 2 groups, a treatment as usual group versus open-label placebo group. They randomized 97 adults reporting persistent low back pain for more than 3 months duration. The treatment period was for 3 weeks with both pain and function measured at baseline and at 21 days. The principal investigator explained to participants that the placebo pill was an inactive substance like a flour pill that contained no active medication in it. 87% of the participants were taking conventional pain medications during the week before entering the trial, whereas only 14% were using complementary treatments. Participants in the treatment as usual group were offered the option of receiving placebo pills for an additional 3 weeks. All participants were presented with a 15-minute script with 4 discussion points. 1. A placebo effect can be powerful. 2. The body may respond to taking placebo pills like Pavlov dogs who salivated when they heard a bell. 3. Positive attitude can be helpful, but it's not necessary. And 4. Taking the pills faithfully for the 21 days is critical. All participants were also shown a video clip of a television news report in which participants in an open-label placebo trial for irritable bowel syndrome were interviewed. Regarding treatment as usual, the researchers did not describe what exactly was involved, but we do know that all participants were told to continue taking current medications, so that 90% of the participants were taking pain medications, mainly NSAIDs, before and during the trial. Now, NSAIDs are reported to decrease low back pain more than double-blind placebo. However, the difference is less than 1 point on a 10-point scale. Participants in the study rated their pain in 3 categories: minimum, usual, and maximum. Now the results. Overall, the amount of additional pain and disability reduction produced by the open-label placebo was approximately 30% of baseline ratings. Open-label placebo reduced pain by 1.49 points on a 10-point scale compared to only 0.24 points for NSAIDs alone. There was a clinically significant 30% reduction in both usual and in maximum pain in the placebo group, compared to reductions of only 9% and 16% respectively in the usual treatment group, those that chose to continue with the open-label placebo. Open-label placebo reduced minimum pain by 16% compared to an increase in pain of 25% in the treatment as usual group. There was also a 29% reduction in pain-related disability in the placebo group compared to 0.02% in the treatment as usual group. Participants in the treatment as usual group who agreed to take part in the follow-up and took the open-label placebo showed significant pain relief on all outcome measures. So after the treatment as usual phase and starting with the open-label placebo phase, there were moderate to large effect sizes. Pain reductions ranged from 1.3 to 1.7 on a 10-point scale. Percent pain reductions ranged from 29% for maximum pain to 46% for minimum pain. Back pain-related disability decreased by 40%, and pain bothersomeness decreased by 34%. The researchers point out that the Institute of Medicine's position is, quote, placebo conceivably may be a form of treatment of pain, especially in light of the shortcoming of other modalities or benefits they bring in their right, unquote. These are interesting and thought-provoking results. However, we must be cautious. This is a small study with only about 41 to 42 participants in each group. Also, patients volunteered responding to an ad for, quote, a novel mind-body clinical study, unquote. Pain scores were mild to moderate, and the treatment as usual group reported lower baseline minimum pain scores compared to the open-label placebo group. Decreases in pain given the baseline levels look more impressive as percentages. For example, if the baseline score is a 5, a decrease to a 3 is almost a 50% reduction. However, the degree of pain relief felt by the participants may not be viewed as that dramatic. So this presents an interesting opportunity for chiropractors. If it is ethical to give a placebo pill, if it is labeled as such, and given the pill is inert, this is not prescribing. Is it possible for chiropractors then to incorporate this approach and add benefit to their treatment? An interesting irony if this is an effective approach, given chiropractors would then be giving their patients pills without having to have prescription rights. Certainly larger trials are needed, but it does appear promising, reversing the past negative connotation that placebo would normally evoke.